Hi class. Today we are going to continue our discussion from the textbook about the ways in which the medical field has changed over the past century or so, and largely due to societal changes and also how changes in the medical field affect society. So we had talked about yesterday, just really quickly by way of review, that first of all, before 1900, there weren't a lot of regulations on doctors, and that doctors weren't well paid. So before the progressive movement and the progressive movement's push for government regulation and the push for expertise in fields, anybody basically could be a doctor. You could just say, I'm a doctor, and you were a doctor. And that meant that the medical profession wasn't necessarily the most respected field. And partially that's due to the fact that there wasn't a ton of scientific advancement in the medical field during that time period. You know, we have experienced from 1900 onward a lot of amazing medical breakthroughs. Things like antibiotics, which are a massive game changer. Things that were potentially fatal or definitely fatal are now very treatable thanks to antibiotics. The Salk vaccine and just general vaccination after that, major breakthrough in the 1900s, right? Things like cardiothoracic surgeries, like grafts on your arteries, bypass surgery would be an example. Heart transplant, artificial hearts, and then just like technology in the field of cancer treatment, like gamma knife technology, among other things, monoclonal antibody treatment, where there's so many advancements in the medical field that the medicine and those who practice it have become much more respected because they're much more able to effectively treat diseases. So before that, though, the medical field was not as respected because it wasn't as successful. Also, it didn't compensate medical professionals as well, right? Doctors weren't as well paid, partially because medicine wasn't as specialized, which we talked about that too. So now, let's talk about some things today that are leading to a weakening of doctors' authority culturally, right? There's something called professional authority, all right? And professional authority is the ability, it's legitimate authority, all right? So it's not illegitimate authority, like it's not an attempt to usurp authority. It's a legitimately recognized authority to define the terms of discussion within a field. So professional authority, like the Bar Association would be the professional authority in the legal field. All right. So similarly, the American Medical Association would be professional authority in the medical field. And it's composed generally of those who've practiced medicine or they have practiced or are currently practicing medicine. But there are some problems that arise with like a central bureaucracy. And one of those is that a bureaucracy weakens the authority of the doctor on the front line. So we kind of see this now currently. If you look at the current situation that we're in, everybody, no matter what the issue is, there are going to be differing opinions. We actually tried this in class at the beginning of the year about liking certain foods that are very common staples, right? There are different opinions on almost literally everything, right? Like bacon, is it good or bad? Bacon, do you like it or not? You know, you'll get different opinions on that. Even like cookies, chocolate, things that are almost ubiquitous. Well, some people don't like them, right? Well, similarly, with a more nuanced thing like a medical profession where there are differing opinions on how to treat certain diseases, on proper course of treatment, things like that, you're going to get disagreement among medical professionals. But we're seeing currently with this bureaucracy that's going on right now is those who don't toe the bureaucratic line are being censured and censored as well, right? So they're being punished, told, hey, don't do that anymore or you might have licensing troubles. And a lot of them are being deplatformed, like videos of doctors. And I'm not saying they're right, by the way, but videos of doctors who are saying, anything other than what the CDC or World Health Organization is saying about our current situation, their videos are being pulled from YouTube and Facebook and things like that. So there's a bureaucracy involved, and the bureaucracy is saying that this is our stance, and anyone outside of this stance is wrong. I mean, you also see that with climate scientists, or if you've ever watched Expelled, which is about people within the science community not being taken seriously, or sometimes being kind of shunned in the community when they think intelligent design is a viable explanation for the origins of life and for our solar system and universe. It's kind of like that, where there's a bureaucracy that's the gatekeeper, and if you don't toe the bureaucratic line, then there can be consequences. Also, so that's one of the reasons why doctors are losing authority, like individual frontline doctors. Part of it is a decline in governmental support of the individual doctor, and there's more governmental support behind giant bureaucratic organizations. So like we had to talk about, UPMC would be an example, or Allegheny Health Network, where they're big conglomerates, whereas it used to be there was just the doctor down the road. And if you're not an affiliated doctor anymore, it's much more difficult for you. Another thing that might not be as apparent, but that can also undermine the authority of doctors, is things like PAs and nurse practitioners, because they are like the front line now, where sometimes it's harder to get in to see a doctor. I know with my doctor, regardless of what it is, if I want to go in the office, it takes me a while to get in. There's sometimes a couple weeks because he's so popular. But with a PA, you could probably get in, I mean, a lot of walk-in clinics have doctors or PAs and nurse practitioners that you can go see like that. And a lot of times, even if you call for an appointment or you go online to schedule an appointment, the PAs and nurse practitioners aren't as booked. And they're still able to give the same medical advice, and they're still able to, like, they can diagnose you, they can arrange treatment, they can arrange referrals, things like that, right? So then it makes the people say, well, then what do I need the doctor for? If the nurse practitioner or the PA is able to come in, look at me, tell me what's wrong with me, and treat me, why do I need a doctor? All right. And then also there's just a general erosion of patient trust over time. Currently in America, societally, there's an erosion of patient trust in the doctor, particularly as the doctors are part of a big bureaucratic organization. Patients may doubt whether the doctor has to answer to the bureaucracy. They may also doubt the doctor's ability to negotiate insurance claims. Like the doctor might be like, hey, I want you to get an MRI. And the insurance company might be like, nope, not paying for that. And people are like, well, what do I do, doctor? And the doctor's like, well, your insurance isn't going to pay for it. So that may be a reason why patient trust has been eroded. Also, there have been a lot of claims. You don't have to, go very far to hear claims about the big pharmaceutical companies, like Big Pharma, big pharmaceutical companies pushing doctors to prescribe certain drugs to treat something. Now, whether or not that's true, when people hear that, it makes them sometimes second guess their physician and think, is my physician prescribing this because it's what's best for me, or is my physician prescribing this because they're being pushed by a pharmaceutical company to prescribe this? Now, I'm not saying that that's what's occurring at all. I'm just saying that that is part of the erosion of patient trust in America. And I'm not saying there's merit to these questions or arguments necessarily. I'm not saying there's not. I'm saying that this is a trend societally. Also, if you look at all the litigation against doctors and nurses, that also shows a general, I think, distrust of or a lack of trust in physicians. Instead of saying the physician did his or her best job. Now, obviously, sometimes there are preventable medical mistakes. We talked about yesterday, occasionally, the wrong leg is amputated or the wrong kidney is removed or whatever it is. That does happen, and that is a preventable medical mistake. But also, I think we're very litigious in our society, and your book has pointed to that as well, that shows an erosion of patient trust. And those things heavy-eroded doctor's authority. A couple other things your book throws out there that I think are accurate. Everything's on the internet, right? And all of us are suddenly medical experts. So we go to WebMD or some other website, and we're able to look at symptoms, and we're able to self-diagnose. That doesn't mean we're able to do it accurately, by the way, right? But those tools make people feel like they know what their condition is, and it also makes them feel like they have a level of expertise, maybe not quite on par with their doctor, but close to the level of expertise that the doctor has. So they might say, well, doctor, you say that I have this issue, but WebMD said it could be this, right? So that's another thing societally playing into our lack of trust or our eroding trust societally in medical professionals. So I'm not saying that that should be occurring, but that is what's occurring. And also just navigating the medical insurance field and navigating all of those challenges as well makes the end user feel like the medical system could be stacked against them. Now, there are a lot of positives that have occurred medically over the past 100 years, and we have some of the best medical technology in the world here, and we have treatments that were heretofore unheard of. But that doesn't mean that people are more trusting, but we've also made great advancements. So society is influencing medicine to respond to what they're saying with their complaints and also with their doubts and questions. And the medical field has changed and is causing society's expectations of the medical field to change as well. So that's it for the medical topic today, which is part of your curriculum. If you have any questions, feel free to email me. Otherwise, have a great day and keep up the good work.